It went from variant of concern in South Africa on November 26th to detected in California on December 1st to now 73% of cases across the country are from the Omicron strain of the coronavirus. It was just 13% the week before. So yeah, we are in a surge when it comes to COVID-19, except maybe here in Idaho. We've had a 14-day average of 350 COVID cases a day, down from 1,300 back in October. Remember that peak? A 17% positivity rate back in September to most recently just 6.5%. And only 2 of those cases have been attributed to Omicron, according to the Department of Health and Welfare. That second one coming through just today. Just 2 with just 15 suspected samples at the state lab. Is that even possible, though? We talked about this yesterday a bit. Not testing enough or just a fluke was the question Lisa asked. And the answer is yes and no. Testing has dropped by a bunch. We've gone from 50,000 tests a week during our September peak to 26,000 just a couple of weeks ago. And even with a 6.5% positivity rate and 350 cases a day, there's got to be several Omicron cases in there, right? Just kind of mixed in, a lot more than just 2, but we still only have 2 confirmed cases. Health and Welfare explains it like this. The process for genomic testing, this DNA sequencing you've heard about when it comes to tracking COVID variants, starts with a positive PCR test, not a rapid test. I'm talking about that long swab that goes up the nose, that sample. And even then, you have to have enough of a sample to get a DNA sequence of the virus. Then that gets sent out of state to be tested, and that could take, up to about 10 days to get an answer. So we're still waiting for an update on that Omicron, or more cases, with those 15 suspected samples out there, and that's expected to come through soon. But there's another way to know how prevalent and increasing Omicron is in Idaho right now. Like the Alpha variant before, Omicron has a certain mutation that is detectable without having it to be sequenced. Remember those gene dropouts? It's a reference we kind of heard in the early days of the pandemic. Well, Omicron has that same detection pattern. This is from the FDA website, this whole paragraph that explains it. It was updated today. And it's a lot of words to say Omicron has a dropout gene marker that indicates the presence of the variant. And local testing sites, like with Primary Health, are seeing that marker pop up more and more.
In fact, our identification of those patients with that marker, which we're waiting for typing, but I'm 99.9% sure it's Omicron, is doubling. That is, the number of patients we're identifying, frankly, on a daily basis continues to increase at a very, very rapid rate.
For example, Dr. Peterman told us their Sunday to Monday rate versus their Monday to Tuesday rate for positive tests with that marker went from 10% to 20%. And that's just with Primary Health. And there's a whole lot of other testers out there. So for sure, there's more Omicron in Idaho than just 2 confirmed cases and a dozen suspected samples. And if there's a bright spot, though, Omicron seems to have peaked in South Africa, where it was first detected just weeks ago, kind of on the downturn a little bit as for now. But as for how severe this new variant seems to be, that's still to be determined and too soon to know for sure.